Good day, all. I'm David Harshfield, and I would like to welcome you to the overview for the July newsletter for the American Association of Orthopedic Medicine. We have 5 contributions this month, all of which should be of interest. First of all, we have the President's Column submitted by Dr. Carl Osborne, who addresses the current developments with regards to osteoporosis and biphosphonates. The FDA has been made aware of possible increased risk of atypical subtrochanteric fracture in women using biphosphonates dating back to 2008. However, the FDA considers the benefit of overall decreased incidence of fracture to offset the risk of this particular subtype of fracture. How to explain these findings when biphosphonates are supposedly increasing bone density? The answer may lie in evaluating bone quality rather than bone quantity. 2 studies are cited by Dr. Osborne. The bone core biopsies in the first study showed similar microarchitecture between the groups, but the biphosphonate population had a measurable reduced mineral content and crystal size compared to the control group. In the second group, improved structural integrity with the biphosphonates group was seen very early in the study. However, the trend began to reverse after 4 years. Continued treatment with biphosphonates was then associated with decreased axial strength and structural integrity. Based on current and evolving science, Dr. Osborne believes patients should be cautious about using these medications for longer than 4 years and even consider using alternative therapies to preserve bone density. The second contribution this month is from Carrie McCormick, who describes the methods of minimizing receiving post-payment denial letters, utilizing as an example a request for a refund for a radiofrequency denervation procedure. Dr. Joel Barenbein provides the third contribution this month, which is an overview for evaluation of the pelvis. In this contribution, Dr. Barenbein discusses the evaluation of the pelvis, specifically iliosacral dysfunction, emphasizing that there are 2 parts of the evaluation of the pelvis, those being the static exam and motion testing. Both parts of the evaluation are performed with the patient standing as well as supine. Dr. Barenbein also provides a very useful criteria for diagnosing iliosacral dysfunction. Our fourth contribution should be of great interest to the American Association of Medical members. The International Cellular Medicine Society, the ICMS, is a global non-profit organization. I currently serve on the advisory board, and I'm also a member of the IRB for the ICMS. This organization is comprised of patients, physicians, and scientists from over 35 countries who are dedicated to patient safety and education in the use of cell-based medicine. Recently, the ICMS released its draft entitled Guidelines for the Clinical Use of Platelet-Rich Plasma, PRP as it's known. The ICMS recognizes the need to create standards for PRP protocols, preparation, techniques, and tracking. The ICMS believes that physician-led organizations such as ours, the AAOM, will serve the needs and interests of both patients and physicians toward achieving the best outcomes. In order to advance PRP in particular, and autologous cellular medicine therapies in general, the ICMS has developed these guidelines to assist us in performing safe therapies, promote patient education, encourage robust clinical research, and begin to define the scope and anticipated effect of these procedures. The ICMS is interested in the professional opinions of the members of the AAOM and any recommendations we might have about the draft guidelines. Please review the guidelines and provide any feedback you feel appropriate to make these the strongest possible standards for PRP therapies. Additionally, the ICMS is unveiling a new PRP treatment registry to track our patients with regards to the outcomes from their PRP therapy and treatments. Built on the existing stem cell database, this will be the first registry dedicated to PRP outcomes. The ICMS is interested in speaking with PRP providers about the data to be collected and levels of reporting needed to provide a PRP registry that is both valuable and useful to our practices. It's the goal of the ICMS to develop a reporting model based on feedback from clinicians, particularly members of the AAOM, to ensure that we are getting the data that we need. Those interested in participating in the development of this powerful new tool, please contact the ICMS. They look forward to working with us. And finally, it's a great month for America, everybody. July 4th is the 234th birthday of our country. So in taking with the celebration of our country's independence and in the context of the recent legislation out of Washington with regards to health care, my contribution this month is a lighthearted editorial that I've entitled The Declaration of Medical Independence, in which I present a few observations and personal ideas of how we might best go about this much-needed correction of medicine. With that, please enjoy the newsletter. We look forward to your comments and contributions. So until next month, so long and be safe.